Welcome, our beloved viewers, once again to this week's episode of the Voice It Show. Thank you so much for joining us as we walked through all the stages of marriage in our series titled Let's Talk Marriage. And if you haven't watched that yet, catch it on our YouTube channels as shown below. This week, we want to start on a new series of health and wellness. And to start us off, we'll be talking about mental health. This is a very new issue that is cropping up among the youth in our current society. I'll be your host, Keith Kinoti.
Well, here are some startling facts just to show us how important this topic is. 33% of Kenyans are tested to be angry, 61% are tested to be lonely, while 52% are tested to be helpless. Kenya is ranked to be 29 globally based on the mortality rate caused by mental health. Today, we are glad to be joined by a clinical psychologist by the name Mr. Stephen Micheo, who is going to shed some light on some of these gray areas on mental health. Thank you for joining us. I'm your host, Nelin Kirote. Karibu Bwana Micheo.
Thank you, Kirote, and thank you for this opportunity to discuss some few things about mental health. I want to say that mental health is very wide, and thank you for the points that you put across. And it's important for Kenyans to know, and the world to know, that mental health is the key thing, especially in this time of COVID. Very important for us to know that we say that without mental health, there is no health. And that is why this topic is very key and very important for all of us, and for whoever is listening to us, so that we be able to understand. I think I should begin by introducing myself. My name is Micheo Stephen. I'm a clinical psychologist currently working in Kenyatta National Hospital, our teaching and referral hospital. And I have experienced some few years of work. And maybe as you continue to share with you briefly a few things that we are doing in the hospital through the session that we shall have today. But allow me to begin by discussing health to begin with, because that is where we begin. When we talk about mental health, let's begin with what is health. And the World Health Organization, which is the body that helps us to understand about health, tells us that health is a state of complete physical, mental, social well-being, and not merely absence of infirmity. It's not merely absence of maybe what we call disability and such. Important then for us to now come down to what we are calling mental health, after you have known what health is. Now, mental health now includes our emotions, it includes our psychological issues, it includes our social well-being. It also affects how we think, it also affects how we act. Now, these are very key things, because like we have had the issues about Kenya and how we are suffering, as Kirote was trying to elaborate. It's important for us to know that our association with other people majorly is dependent on our psychological well-being. That is why, as he's saying, some of us are maybe sad. Now, when you're sad, it's important for us to know that you cannot relate well with other people. Now, I think those are very key important that we need to understand when it comes to issues of mental health. And I would say that it is important for us to be aware, because what the problem that we have today is that most of us are not aware about issues of mental health. And we begin to think of mental health when we think about someone maybe who is admitted in our only psychiatric hospital like Madare. I ask some people, what is it that you call mental health? And our mind runs to Madare, that because that's the first word to come. The others, we think of someone maybe who is in Ngong town or Nairobi or any other town that is collecting garbage in that place and is not employed by the council or the county council or the town council of that area. Now, some of us, that's how we think about mental health, but it is more to that. And I want to believe that is why the team is coming up with us discussing what mental health is, so that we are able to help our people to understand. But it's important for me to say that now that health is complete in the physical, and the mental health is to deal with issues of mind, to do with how we act, how we relate to the people, and how we work with others.
Thank you for that, Mr. Michel. But as you said, mental health is a sub of health. As we know, all medical conditions have symptoms. what could you say in a couple of points are some of the signs that we can look out for to say that these are the signs of someone who is not well mentally?
Thank you, Keith, for that question. It's important very much again for us to understand that the person I spoke about correcting garbage in the town is actually mentally sick. I don't deny that. But it's important for us to know that there are some other aspects of signs and the symptoms of mental health that we need to be aware of as we walk around. And I don't want to go to those big jargons jargons of words that we use in psychiatry. But I want to say in very simple terms, if you find someone, number one, is not able to function optimally to his chores or functioning at home, it's important for us to ask ourselves, why is that person behaving the way he's behaving? On the other hand, we have some people who are irritable for no cause reason. Sometimes come to an office and you don't want to talk to anyone. You're just quiet. You just want to do your things. Now, sometimes we look at you and we start maybe gossiping, you're talking about you. There is a likelihood that you have a mental issue that that is affecting you, and therefore it's important for you to understand that. The other thing is some people who are what we call mood swings. Sometimes he's happy, other times he's disgruntled, disgusted. Sometimes he is irritable. You find him fighting for no reason. Now, other people sometimes when they have mental health issues, depending on how they got the mental health issues, they actually react badly to other people. Sometimes you find someone in an office, you just come and ask him, how are you? And the question he asks you is, why are you asking that question? Instead of saying either I'm fine or I'm well. Others, I remember someone who once used to tell us, when you ask him, good morning, what is so good with morning? Now, when you ask him what is so good with morning and I was trying to greet you, I was happy and you are gloomy, it means you have some psychological issues that are disturbing and therefore you have a problem mentally. That is some of the things that we need to understand now. Other signs now include the ailments themselves, where someone maybe in some situations is not able to eat or to feed properly or to feed as he's supposed to have done. Others, they just run away from their homes. Others, they have what we call addiction problems. Someone is taking alcohol, maybe has not been taking before. And we are quick to judge such a person, but we do not understand that there could be something behind why he's taking that alcohol. So it could be that he's having some mental health issues where he's coming from, and that is why he's taking that alcohol. There are some who don't go to work. He's just woken up in the morning, he's feeling, I don't want to go to work. Sometimes they say I'm flat. And the employer we really sometimes do not understand. And that is why I think this is very important for us to understand that when we learn about mental health, we are able to help our people. If it's coming to church, someone says first Sunday was not there, second Sunday was not there, we're not asking the reason. Now, in this case, what I'm saying is you are not doing what you are expected to do. And even if you are doing, some of us, we do it late or we do it in a speed that somehow is wanting. That one tells us there is some problem that you are going through, and this could be psychological, and therefore this is mental health problems that are with you.
And what of the cases of online diagnosis? We've heard of people going into Google, typing in their symptoms, and Google tells you have typhoid. Or is it proper to self-diagnose some of these signs?
Thank you, Kate, for that question. I think Mr. Ngugu has come to help us very much in very many areas, including sometimes we perform in our exams, and because we have Mr. Ngugu with us, especially we're allowed to do a laptop like our mine. I hope it's not fixing. Okay. Now, when it comes to diagnosis of mental health, it is very important for us to understand that we do not have knowledge on that area of diagnosing, because there is a likelihood when someone comes to us and is behaving the way he's behaving, sometimes we label them. Now, there is likelihood also the individual person can label himself without understanding what is happening with him. And that is why making a diagnosis is very key. In this case, when it comes to us in psychology and psychiatry, there are some tools that have been developed. There are some strategies that have been put in place for us to consider and therefore come to a conclusion that you have a diagnosis of a mental health problem, whatever the name we call it thereafter, then it matters. So it is not okay for somebody just to go into Google and try to look at some of the things, because we may not be very sure of what are some of the symptoms he's feeling. Sometimes he may be cheating himself, because if I start singing the Wakorino song around here, some of you may think I'm going berserk. But to me, I'm actually enjoying what I need to do now. One of the problems with Google is those people who send something to Google sometimes may not per se be either medics or professional in a way, because someone can send anything there. And that is why it is important for you to, number one, when you feel you have a problem, seek for help. When you feel like some things are happening around you, seek for help. And when you come to us, it is true that there are some tools that are put in the Google that can help you know yourself. However, this should not be conclusive until you've seen a profession and confirmed what you've seen. So that was also about that question. That is very important, because I know in Kenya we have all them for the knowledge around, but sometimes we don't know how to handle it.
Thank you very much for shedding light on that area of not to self-diagnose and not to consume everything that is on Google. So, as they say, where there is smoke, there is fire. So, what are the causes of this mental health condition?
Thank you, Kirote, for the question about the causes. And a myriad of problems in psychiatry do not have a known cause. In fact, most of the diseases that we talk about, be it be depression, be it be other psychiatric conditions that you have around, do not actually have per se the cause. But a number of things we say when you're talking about mental health. Number one, it's important for us to know our environment plays a great part of what we are and who we are. Be it be the environment where we were brought up, where we go to school, the church, or other social gatherings that we attend. They have a key part in our mental well-being. That is why it is important for us to know that some of the causes then may be coming from those areas. Now, when I talk about environment, I am speaking of a situation where maybe a primary school teacher is calling a mtoto ugali. Is telling you are as foolish as your mother. Now, such a child may develop psychological or mental illnesses out of that because of what Marimu said. It all begins with maybe what we call self-esteem. When you have low self-esteem, a number of things happens around you. Now, the other thing is when it comes to causes of mental health, there's something we call genetic. Genetic is where somebody is born by a parent who has had the genes of the disease that he has. And science has actually attached a lot of psychiatric diseases with the genes, where they're coming from the mother, because we realize that this is a son who is suffering from depression. But we are seeing at some point the mother may have had depression or some other condition related to depression. And you hear the grandmother actually may have committed suicide. And this could be also as a result of depression. Now, that is what called genetic. Genetic means that kuna chembe, or what you call, there are some genes within you that are being passed on from one parent to the other, and then to this other child. And we have a number of diseases that actually have been found to do that. Now,
just to cut you short on
yes.
that point, so is it right to assume that depression and mental health per se can be genetically passed down to the child?
That's a yes and no answer. Let me explain about the gene. Most of us have some genes that have a problem. But because of the environment we are reared in, they may not per se come and find a place to manifest as that disease. So likely that your father may be having depression, but it may not appear to you because of how you've been brought up. Otherwise, if there are some situations, what they say that if a few things meet together, it can become a problem. And that is why it is important for us to know that not all of those who have genetic problem usually develop the conditions. Like we found in alcohol, of great science has connected alcohol into genetic problem. And we've realized that some of our parents who are drinking, we are not drinking today because maybe we went to church and we are cultured differently. Therefore, the gene that was my mom or my father is not coming up. So it is not right to say that all those people who have genetic problems can actually erupt to a problem thereafter. But thank you for the question. Now, as I continue about what we're calling causes of mental illness, I started by talking about environment. I talk about genetics, and then now we have another problem which is coming up of the complications of some of the chemicals that we are consuming these days. It's important for us to realize most of the diseases, including cancer, are actually emanating from some of the chemicals that we are coming through. Therefore, when we are living in such an environment where we're living, where like somebody was telling us the other day that we are the children of Mau Mau. The children of Mau Mau is expected to be, because of his upbringing, is expected to be a bit violent. That means, and you know, most of the patients who are in Madare or those who are in mental health institutions usually are violent. Likely that an environment can exacerbate or can increase the risk of you developing that condition. Now, together with that, I want to bring in two other issues that have become pertinent in Kenya. And one of them is drinking. Because when someone drinks, there is likely, because of his behavior, with the alcohol coming in, it can change his behavior and therefore can be manifested into psychosis. And that's why we're having in the hospitals what we are calling a alcohol-induced psychosis. Mtu amekuwa na wazimu kwa sababu ya kunywa pombe. On the same time, there is something that I want us to think critically and think seriously when it comes to us and what we are calling stress. Because stress is actually, it begins by being environmental, where the environment around you dictates that you do not action properly because the situations that are surrounding you. Could be because of, like now we are talking about COVID problems, where people are sick, they are staying at home, they don't have something to give them something on the table to eat. Some are having some other issues that are emanating from the effects of COVID. Now, that is all the disease. We have some other diseases because what we are realizing is people who have some other diseases, they might actually go into psychological problems, psychiatric problems, emanating from the disease that they have. For example, those patients who have what we call chronic ailments, the feeling that I will take these drugs forever. For example, when someone has diabetes, maybe you are injecting yourself for some time, and some of them, they come to us and tell us, me, doctor, I don't want to take these drugs anymore. I'm tired. I better die. Now, that one tells you he's having some psychiatric problem that are developing from that disease he has. The others who are maybe epilepsy, and you know, we have a lot of stigma that is attached to those other diseases. Like when someone has hypertension, we want to talk under low tone, the SSK we are talking. Others, when they have epilepsy, because of the issue, you know, when you have epilepsy, you fall anywhere. Now, some of them, because of that stigma, they hide themselves. And we have realized there is actually, even scientifically, there's a connection between epilepsy, because it affects the brain, and psychosis. So we have some children and adults who have that problem, and many, more, including kuanguka exam.
Now, could you kindly shed some light on some of the preventive measures that you can take in order to prevent this psychosis?
I didn't want us to taper down from psychosis because we have a problem when it comes to talking about psychosis, because these are psychiatric diseases that are there. But you see, before you go, how do you get to a psychiatric problem? It begins by just social things that are surrounding us. We have said when you take alcohol is at the beginning what you're calling a stimulant. So you take and you feel high. But as you continue taking, it becomes antidepressant. So your mood starts going down. So that's why I'm saying, let us not talk about psychiatric problem first. Let us talk about psychological issues that may now bring the issue of the disease now. The question that I ask is, when you find that person we think was collecting garbage in town, how did he get there? Now, I think that's the question you're asking me. So that we begin by looking at our inner person, because there is something we call self-drive. Now, some of us, maybe because of what we call personality traits in us, or our upbringing. Sometimes when you look at our parents and what they are going through, I think I want to give an example. Look at a child who is in high school and his parent is genuinely telling him, I do not have school fees, and he's sent away from school. Now, that one tells you this is the beginning of a problem of that child, because number one, he may not be able to attain his goal the way he had wished. And if there are some of these people who are self-driven, sometimes they feel embarrassed. Sometimes they feel low in mood. Sometimes they feel down. And therefore, this one tells you that his or her self-esteem is going down. And likely, this may affect his mental status or mental capacity, and therefore, out of the desire to perform, he may not be able to perform. Now, that one also complicates the problem, and therefore, a psychiatric problem may emanate. Important for us to understand that.
It's a growth.
It's actually progression. It progresses from this stage to another. Let me take someone who is working, maybe is in an office, and that is not able to meet the target. Now, some of these are the ones whom, because depending again on the personality and the desire to meet the desired requirements by the employer, sometimes because of that lack of meeting what he wants, so some they have usually have the low mood, still goes to low self-esteem, and therefore, if there was a genetic problem that is in name of a depression, then go into depression. Now, you ask the question about prevention. I want to begin by talking about the self, because it's important. When we talk about the environment, an environment composes of very many other things and the self. And self-awareness is very key and very important. Self-awareness emanates from a situation where I'm able to call a meeting with myself and understand myself. This is me and this is what I am. And if someone stretches to stretch me beyond what I am, I may not be able to perform. Now, one of the problems we have with mental problems is some of the people that we have, they are actually trying to meet the demand of everybody, everywhere. When it comes to the church, you want to be the best singer. And you know, your music is like that which the Bible says, make a joyful noise to the Lord, just as a frog does. Now, but you want to show to the multitude that you want to be the best. Now, when you come and you stand in front and you're not performing, what happens is sometimes, obviously we will comment and tell you, oh, Leo, you needed some help. Now, when you tell you that, the following day you just look at yourself and you actually may sit at the back of the seat. That tells you you're having some problems that are affecting you, and that's why you're not performing. Now, self-awareness is very important. What can I do? What can I do? Now, when you have self-awareness, it's important for you to speak about yourself. Let whoever you are meeting know what you are and what you're able to do and what you're not able to do. Now, one of the problems we have in Kenya today is where we have some students who have gone around the exam and they're able to perform. And when it comes to the performance, whatever they have the marks for, they're not able to perform. Now, these are some of the students you realize they are called in medical school. And in the second year, they are seeking to go to an art class because they have realized whatever I got, I do not have. Now, that is being self-aware. This is what I want to do. This is me. This is what I'm able to do. Now, let me talk about the environment now. When it comes now from self and go to the others. And the next person that we have around is Mzazi, the parent. Now, some of the demands of the parent are actually causing some children to have problems, mental health problems. I'll admit that I'm actually attending our youth clinic in our hospital. We have realized that 70% of the children who are sent to our clinic are actually having problem with alcohol. And when we ask them how they came to learn how to drink alcohol, they're telling us it is the parents who taught them. Now, some parents are not aware of this. But when they come for counseling session, they realize, by the way, I am the cause of this problem. Now, the demands of the parent. Now, a parent understands or does not know you from the primary school. So he does not know why you got 250 marks and not 500. Therefore, it tells you, as you go to Form 1, I need an A and not an A minus. If you have to do the worst, get an A plus. That's what they tell us. Now, such a student going to school is already mentally disturbed because he does not want to meet what he is and what he is able to, but he wants to meet what his parent is saying. So now, when he's in school, he has some other part of the environment, which is the peer, the student that is working with. And some of them have actually been cheated previously and told, if you take bangi, you're able to perform well. So some, they decided to praise my father, let me do what others are doing, so that I can transnight. They call it transnighting. They want to read the whole night, so that in the morning at least they have. One thing they do not understand that when you take a bangi, one of the effects of bangi is, in a layman's language, it postpones some of the things that you have learned now or you have done now.